Thanks everybody for tuning in today. I am Adie McKenzie. I am a clinical advisor with AIROS Medical. And my friend Keri Palm is here to share a little bit about her story and what works well for her with pneumatic compression pumping. But I want you to hear how she got there. So, Keri, thank you for joining me. And do you mind telling us just a little bit about like your initial diagnosis with breast cancer and how that led you to learning about lymphedema?
Sure. Thank you, Adie, for having me, and Eros just for allowing me to come on and share my story and my journey in lymphedema. So I was diagnosed with stage 3 triple positive breast cancer at the age of 38. And I was diagnosed in 2018. And I was in a unique position where my treatment was at an Army facility. And I was blessed that they had a breast cancer program actually there. And so they were very well aware of lymphedema from the beginning. And they actually did my initial measurements and LDEX prior to starting chemotherapy. And then throughout my journey there, they were continuously reevaluating and remeasuring and testing to try to catch things early. I think they had limited resources, but a lot of knowledge, which I was thankful for.
Yeah.
Could they could point me in the right direction for the resources if they didn't have it. So shortly after, I did a chemotherapy first, followed by a bilateral mastectomy without reconstruction. And then I also had 11 lymph nodes removed. And then I did 25 rounds of radiation. And so my lymphedema actually showed up very shortly after my surgery. I started complaining of just a full feeling in my chest wall, actually,
Mhm.
kind of in my lateral muscle area and across my rib cage. And I was referred out of the Army system to a lymphedema therapist who was an occupational therapist. And so I started my treatment in 2019 for lymphedema. It was very well managed with some manual drainage and self-manual drainage. Compression at that point, they didn't really recommend. And so unless I had kind of this full feeling in my arm, or they did do some preventative stuff because shortly after my surgery, I had about a 16-hour flight I was going on.
Mm.
And so I did wear compression, and that was highly recommended. And where I was going to the Middle East. It was very hot. And so I did wear compression while I was there. I wore
Can I
compression.
just clarify when you say you wore compression, was it just on your arm or also on your chest?
Yeah, I wore both actually.
Okay.
Particularly when I was over there, I wore the compression sleeve. Um, and then they also recommended that I wear some compression, like tank top type garments,
Yeah.
um, underneath whatever else I was wearing for the day. And so that was kind of my initial introduction into what was available for compression. I received that treatment from the occupational therapist for about, it was probably about 2 years, with no really progression. I was living in Washington State at the time. So we relocated during the pandemic to Tennessee, where the weather is very different. And it was almost immediately that I noticed the change in temperature was really affecting my lymphedema. It was very humid here in Tennessee, and so I had to start wearing my compression a little more frequently. And so I had gotten connected with an oncologist, and he quickly recommended I start PT. And so I got connected with a physical therapist in lymphedema, and quickly learned that my body responds a little differently to treatment. And so I wasn't getting a whole lot of relief from a gentle touch. I really got more relief, probably because of scar tissue buildup um, from a firmer touch. And I was thankful that my therapist listened and was willing to hear me out and just try something a little bit different. Because I ended up getting a fair amount of relief to the point where I could go back to just wearing compression when I felt like I needed it. I really listened to my body and knew my body. The foods that would affect the amount of swelling I had, along with the amount of exercise, would directly impact me in how much swelling I had or didn't have, along with the types of treatment that she could offer. And so we experimented with a lot of things. I started out in a 20-30 compression sleeve without having to wear a glove. I am a nurse by trade, and so when I started back to work here in Tennessee, it was pretty hot. And so my body quickly responded to that. And I went from having treatment probably every other week for a little while, probably 6 to 7 months. And then we stopped treatment for a good chunk of time. But in that first initial 6 months that I was here in Tennessee, my PT introduced me to pneumatic compression.
I want to just circle back a little bit because you have brought up so many important points.
Yeah,
You were lucky enough to have, right at your diagnosis, you were able to get an LDEX. So you were able to know what your status was before you started having intervention, correct?
correct.
That's something we therapists in general would love to see for all of our breast cancer patients. And it isn't typical. So you were very, unique in having that and having providers who were looking, maybe weren't as resourced as some, but had
Mhm.
the knowledge, as you said, to be looking and advising and referring.
Yes.
You also noticed that things changed over time, not
Mhm.
just with your activities, but with your environment
Yes.
and with just time moving forward. And so activities as far as travel and then activities as far as work, all of these things affected how you felt. So lymphedema, we know, can be something that can occur anytime after we've assaulted our system with the surgery, the radiation, that you pointed out that you had quite a few radiation treatments, that all of those things can cause problems with lymphedema, and that there's no time limit on it.
No.
Things can happen and change and worsen and improve over a period of time without there being any standard. And then one of the other things I think that you said that was really important for people to keep in mind is that your body responds differently to what most of us therapists are taught to expect from our patients.
Mhm.
We're taught to expect in most programs that this light touch is going to help move lymphatic fluid. And actually, the science is showing that that's not like your body actually was an example of what we're discovering is more likely to be true, that
Mhm.
there isn't one level of pressure that is the ideal level of pressure, that it varies person to person, that breaking up scar tissue can be huge for facilitating the movement of the fluid where we want it to go, and that sometimes we just need to use a firmer and slower approach with our patients than what most of us who've been doing it for a while were taught, because the science is proving that that is more effective for moving that fluid if there's a lot of fluid in the dermis. And I don't want to get too scientific here now, but that we're finding that those kinds of strokes can be really, really effective for people. So I just think you pointed out so much important stuff. I just wanted to highlight that. And then
No, thank you.
keep
Yeah.
talking about you discovered pneumatic compression.
Yeah, I discovered pneumatic compression. And so It was challenging for me to receive that. My insurance company can be helpful. Um, and however, there are some things that I have learned I've have to advocate for.
Yeah.
And lymphatic compression was one of the things that I recognized pretty early on in my journey that was going to take a lot of advocacy on my part as the
Yeah.
patient. And so I managed to get the pump. It did take a while. It probably took about 2 months for the whole process, from ordering and measuring. And then it took about probably 6 weeks for me to receive it. And then it was probably 3 or 4 weeks for the company to send out someone to help me make sure it was a good fit. And actually, they couldn't initially when I got it. Let me back up. Initially, when I got it, they were unable to send anybody into the home. And
Right.
so I had to wait, and it was not a proper fit. And so, working with my lymphedema therapist, we were able to get a new garment ordered that was a better fit, and then the company was able to send somebody out to make sure that fit was correct for me. Um, which I think is really key to any type of pneumatic compression, and that it fits properly, and
Yeah.
that you can work with your provider in figuring out how to make it fit properly, whether that is measurements or with my initial pneumatic pump, I had to use some like padding and types of things just to fill in some gaps.
Who told you about that option? Was that something you just figured out, or did your therapist tell you could use some padding, or did the company?
Yeah, my therapist told me that I could use some padding, and she had some great recommendations um, for that. And some of those were available for purchase, and other things she was able to configure in her office to help in some of the places that I was really struggling with to get a good fit.
Yeah.
Uh, so that was my initial entry into pneumatic pump, and I did see a significant change in my fluid retention with being able to use that on a daily basis. Um, in the heat of my flare up, which was brought on by a really hot um, spring in Tennessee.
Yeah.
It took me about a year to get it under control. So I had to have a lot of patience and explore a lot of options in just trying to make sure I had a good fit, communicating effectively with my provider in just how my body was responding, and also being very consistent in wearing my compression garments along with the pneumatic pump. And looking at, I kind of brought in some other modalities as well in there to help with the management of that flare up that I was having.
Hmm. So you found that the pump really did help, and you needed to use it every day to get the results you were seeking?
Yes.
Yeah.
And then was recommended by my physical therapist that I may be a good candidate for some surgery, some lymphatic surgery. And so I had an LVA completed with 13 connections um, for my lymphatic system, where they have attached my lymphatic system to my venous system to help drain some of that fluid. Um, According to the surgeon, it's been successful. Um, in that process, though, I did quickly realize that my previous compression pump maybe was not the best option for me, as I was really struggling post surgery to get it to fit well. And I'd had those struggles before because I had to kind of um, figure out, where to put pads and other things to fill in gaps. And so it was recommended that I try a different pneumatic compression pump. And that one was a really big game changer for me post-surgery.
Yeah.
After the surgery was done, I had to wait 4 weeks to be able to use the pneumatic compression pump. And I had gone back to my previous one and was recommended, hey, maybe try this other device and just see how it feels. And what was different about it was that it would inflate to fit my arm and my elbow, which was always a really sticky place for me to find a good fit, and my axilla area. And so, along with my clavicle, that was also another really hard place to have a good fit for me. And so, this new compression pump, um, my experience was very different. And so, a provider was able to lend me a pump to try it to see, is there a difference? And the problem was my insurance wasn't going to pay for a new one. So I
Yeah.
was with it was not, I was within my 5-year window for my insurance. And so I wasn't going
Yeah.
to be able to get a new compression pump. So it was going to take some research and work on my part to prove that something else might be a little bit better for me. And so I was able to get my hands on a pump to try, and it was a 3-week trial that I collected data. And every time I would use the pneumatic compression pump, my physical therapist had given me spots to measure, specifically in my hand and my wrist, because I was having post-op, I ended up having swelling in my hand, which I had never had before. And so we were trying to get a good fit in my hand as well, knowing that my lymphatic system was working there, or it had been at least prior to surgery,
Yeah.
and trying to find a good fit. So when we tried out the second pneumatic pump, which was a fit to fill type of pump,
And the one that you were using was the AIROS?
was the AIROS, yes.
Okay.
Mm-hmm.
So
So
yeah.
I was able to try the AIROS, which was great for me, for my body. We were able to prove that actually my hand and my wrist would go down anywhere between a 0.5 centimeter to 2 centimeters after using the AIROS pump comparatively to my other compression pump that I had. So with the data that I was able to collect and documentation from my physical therapist, we were able to successfully have my insurance company pay for a new pump in actually 3 years instead of 5. So that was a really big win for me
Yeah.
and the management of my lymphedema.
Again, you're pointing out all these important themes that I think I hope that people listening to this will notice that, there is a 5-year window with most insurance plans
Mhm.
before they will cover a new pump. But with a status change, which you had, you
Mhm.
had hand swelling and now you do. So, a status change will also often put a person in a position to be able to obtain new devices
Mhm.
sooner than the standard amount of time. And also that, all the pumps fit differently and work differently. And,
Mhm.
I'm a huge fan of our products at AIROS, and I think that we have a superior approach. And I've heard patients say that they respond better to another product. I think that it's important for all of us to be aware that in the world of of daywear compression garments, there are
Mhm.
numerous great companies that have differences in the way that they make their products.
Mhm.
And that's true in pneumatic compression as well. So it's fantastic that you were able to be successful with your petition with your insurance company,
Yes.
um, because these devices are an investment. One of the things I like about our product is that often if a patient is paying out of pocket, it can be a more affordable choice. But
Mhm.
hopefully we get our insurance to support our needs as lymphedema patients. So,
Yes.
so how are you doing now? What do you think?
Um, I am doing pretty well, actually. I feel like I am in a really good spot of being well managed. Um, I am about a year and a half, yeah, roughly a year and a half post surgery,
Uh-huh.
and I am slowly decreasing the amount of compression in my arm with my daily compression garments,
Hmm.
along with the type of compression. Um, but I am still using the pneumatic compression pump just because there are certain areas, particularly my chest, and my elbow, that I feel like just need usually a little more support
Yeah.
at the end of the day.
Yeah. So your mode of operation is to use it at the end of the day. Do you find it soothing? Do you find it calming? Is it stimulating? What do you notice about the pumping experience?
Yeah, my pumping experience has been really interesting. I have struggled for a really long time with some insomnia type symptoms, and when I get in my pump, particularly in the evening, I do feel like it is calming. More, probably more nights than not, I will fall asleep in my pump.
Yeah.
And I will wake up when it's finished.
Yeah.
When my body is no longer feeling the stimulation, it's like, oh, it's time to wake up.
Yeah.
Um, so I have noticed that it's actually helped with my sleep routine as well.
That's very nice. I'm glad to hear that. I think everyone responds to that differently, but I know
Mhm.
for myself, if I use the pump, and fortunately I don't need to do it daily, but when
Mhm.
I do use it, it is very soothing and helps me sleep.
Yeah,
So I'm glad you noticed that too.
been a secondary benefit for sure.
Yeah, yeah. So you are having good experience with the AIROS pump and you continue to use it. Anything that you would suggest to us? Like, is there something that you notice that could be better?
At this moment, I can't think of anything specific that I would change about, design or um, I do appreciate the ability to change the the fit, particularly in the chest with the Velcro.
Yeah.
So I can tighten or loosen if I need to do that. Um, yeah, I don't think I can think of anything specific that I would be like, oh, that would be a good design change at this moment.
Well, if you do, let
Yeah,
us know.
yeah.
But I know I sprung that one on you, but
No, that's good. I think that's good. I will say that the AIROS is definitely easier to travel with.
yeah,
It is a little more compact than some other pneumatic compression devices out there. So I have appreciated that. I can put it in my suitcase if I need to. I usually travel with it in a separate bag
yeah,
as a carry-on with me, but if I had to, particularly if I'm driving somewhere, it's definitely can fit in a suitcase with
yeah,
my clothes. So
yeah, nice.
mhm.
Well, I think, you've answered most of my questions. I wonder if you have like, just some thoughts, not necessarily about the pump, but just in general, like what you would share with other women or men, anyone coming after us who's dealing with lymphedema, especially in the upper body. And,
Mhm.
what words of encouragement or advice would you share?
Yeah. I think my biggest tip would be to listen to your body, and not just dismiss something that you think might be like a muscle tightness or um, like, oh, I'm just sore or I'm just, like if you're feeling something off in your body, I think it's wise to ask some questions.
Yeah.
Because the earlier we you can catch the lymphedema as for yourself and bring it to someone else's attention and get treatment, um, the the likelihood of lymphedema progressing or even being unmanageable is less at that point. And
Yeah.
so I think early intervention um, is key. Um, I also think that, one of the things I had to overcome was in the research, there's a lot of research out there, more so than there used to be. And I think just taking the time to educate yourself, because certain things that I thought might be harmful to my body aren't for me. And so one in particular was weight training.
Yeah.
And that was a big one because I had avoided it early on. And then I found out like, oh no, actually this may be helpful. And my body does respond well. And my lymphatic system responds well to weightlifting, which I would not have anticipated.
Yeah.
Um, so I think just asking questions and really being your own advocate for the diagnosis of lymphedema.
Yeah. Boy, I think you're pointing out some really important details once again because the research has evolved. And when I was trained as a CLT, as certified lymphedema therapist, I was told to tell my patients, and of course, being a lymphedema patient myself, to avoid the weightlifting and
Mhm.
to, I mean, back in those days, they were still saying things like never lift anything over 15 pounds with arm lymphedema. And we know that is not true now. We know that appropriate progression of strength training is preventative
Yeah.
and helpful. So,
Mhm.
yeah. So, and advocating for yourself. You've just given us so many shining examples of how you've been successful with self advocation. And I think, especially women who of my generation in their 50s and 60s, we were trained to be nice girls and not to question authority too much. And sometimes we really have to put ourselves first.
Absolutely.
Well, Keri, thank you so much for that. And I'm going to sign off now, but I'll continue to talk with you, okay?
Okay, sounds great.
All right. Thanks. Thanks, everybody.